Good afternoon, everybody. I'd like to just give a little bit of understanding of how St. David's Healthcare has been preparing for the Ebola situation that's been occurring. Obviously, we've ramped up our efforts over the last several weeks as we've become aware of the situation in Dallas, and especially over the last few days. So I want to frame this up with the three main areas that we're focused on. One is the area of detection. So detection and then protection of our staff and the community at large. And then lastly, how we're planning to respond. So as far as detection is concerned, every time a patient approaches our emergency rooms or freestanding emergency rooms, urgent care clinics, and now in our physician practices that are aligned with St. David's, we're asking another simple question. Not only do you have a fever and some of the symptoms that are associated with Ebola, but we're asking, have you traveled outside the United States in the last 3 weeks to the specific continent of Africa and West Africa, and those three countries that are specific having pandemic experiences with Ebola? With that question, that's a differentiator for us, and that triggers a response where we're isolating the patient, we're bringing them back, and you'll hear a little bit more about that as well. Protection. We are very aggressively looking at all of our materials, all of our supplies, looking at training our staff, going back and retraining staff in the donning of protective equipment and the taking off of protective equipment. We're in contact with the CDC, local health departments, the state health departments, regional agencies that are coordinating the efforts. And we're sharing learnings, and we're evaluating all of our plans against those learnings, and I'll say daily. We have daily conference calls with our teams. We're in the process of spinning up dedicated staff to deal with these patients so that that crucial team that's taking care of these patients, if that were to occur in Austin, are fully prepared and feel very comfortable having practiced with the protective equipment time and time again. The last thing relative to response is that we are again coordinating our response with the city, public health, with regional agencies, with the emergency management office of the city of Austin, and contiguous counties. Yeah, this is a Tyvek suit with the boots and a respirator mask, and then this particular suit also has a face shield attached to it as well. Again, when you don a suit such as this, you're dealing with potentially hazardous chemicals. So anytime there's a hazardous spill, but we're going to be using this for when EMS, if they were to transport a patient to our door, our team would be greeting them at the ambulance down in these suits to, again, protect our staff and ensure their safety as well as those in the community.